So we're going to be talking about spontaneous venous pulsations, which are spontaneous, which means they come and go on their own. It's on the venous side, and the reason it's on the venous side is the vein doesn't have a good muscularis and cannot autoregulate, so it collapses. It's susceptible to pressure. And we're looking at a pulsation. The pulsation is created by changes in the blood pressure related to intracranial pressure at the connection point where the optic nerve head is in relation to the CSF pressure. So elevations in intracranial pressure can cause a spontaneous venous pulsation to occur that is visible on the optic nerve head. So under normal conditions, changes in the delta of the blood pressure under conditions where the ICP is constant lead to a spontaneous venous pulsation. We can see that venous pulsation on the nerve head because the vein is getting smaller and bigger. A pulsation related to blood pressure, but modulated by intracranial pressure at the optic nerve sheath and at the connection point with the optic nerve head. And therefore, the presence of spontaneous venous pulsations can be used as a marker that we do not have elevated intracranial pressure at the time we are measuring that. However, because there are other factors, including the anatomy of the disc head and the blood pressure, which you cannot account for, the absence of spontaneous venous pulsation doesn't mean the intracranial pressure is high. And some people don't have spontaneous venous pulsation and they're normal because there's something different about the anatomy and the structure of their disc head that is not allowing the manifestation of the SVP. And so it's not really as helpful when it's negative. However, if it's positive, it does tell you that we have a spontaneous venous pulsation and it is evidence that your intracranial pressure is normal. The problem is it's only normal at that point in time. And you don't know what it's looking like the rest of the day. So the presence of spontaneous venous pulsation is a useful finding to establish that ICP is not elevated at that particular point in time. Its absence can be physiologic in 20% of the people, and it doesn't prove that the pressure is normal. So when do we use this SVP? In patients where the papilledema is iffy. If you have clear papilledema, I would not use the presence or absence of the SVP to make a clinical diagnosis, because the only way to know what the ICP is to measure it with a lumbar puncture. However, if we see SVP, it is a reassuring sign that whatever you're seeing in the disc might not be papilledema and might not be increased intracranial pressure. I would never use the SVP by itself to make a determination of something that can only be measured.